Hey, Dr. Dan Purser, danpursermd.com. Welcome to another Facebook Live. Thank you all for coming in, checking in with me and listening. I really appreciate it. We're recording this for later use, plus for our new podcast series. So you're going to get to hear all this over again while you're driving. That'd be like torture, I think. Brecken, do you listen to me while you're driving?
I try not to, but I'm just kidding.
Oh.
No, I think it'd be really nice.
For me. Yeah, my daughter for you. Okay, so I get no respect over here. Trust me, that's really true. So just some reminders. Tonight we're talking about men's low testosterone, low libido, low sexuality, low sperm count, low everything, everything. So remember to follow me on Facebook, Twitter, Instagram, Pinterest, email. Go to my email at danpursermd.com and go sign up for my email. This mic is new to me. Do I do anything with it?
Doing good.
You're doing good.
Okay, and you can buy also the physician designed, designed.com website. You can buy all my supplements there. We don't charge shipping. Yes, we're competing with Amazon.
We also have discounts on our website. Amazon doesn't.
We don't ever say that anywhere.
Don't tell that to Amazon.
Yeah.
Oh, sorry.
Thank you, Brecken.
You're
just
welcome.
got us kicked off Amazon. Plus, we offer secret sales sometimes. That's what we call them.
Secret.
So, now all channels are open. DHL sells to Australia, Asia, Canada, and Europe. Mm-hmm. If you order, for all my foreign followers, hi. Hey there. Or, let's see, what do they say in Canada?
Hello.
Hey.
Hey.
Australia, mate. Okay. So, for greatmedibooks.com, you can download any of my books. There are two you should download tonight or today while you can. They're $1.99 each. And they've both been number one a number of times. This is my Improving Male Sexuality, Fertility, and Testosterone. It's 170 pages of pure fun. So you need to get this because it's really, it's going to be this whole thing tonight. This is it, written up years ago. Hasn't changed. It's a reasonable way to work through this from the most natural options to the least and most desperate options. So the least natural and the most desperate options, which are last. In my program 120 Handbook B for men, my male Handbook B, this is for my textbook on preventive medicine. And these are both $1.99 each, so it's special. Grab them now, $4 for the pair. Are you kidding me? You better get these. I'll keep flipping them up tonight, showing them to you. So you buy them. So, because it'll answer all your questions. And then you won't have to listen to this nauseatingly long Facebook Live. Is that right? Pretty much?
No, this is fun.
Okay, this is nauseatingly fun. Facebook. Anyway, I come in straight from work. I've worked all day. I've seen some really awesome patients today. I have a lot of fun at work. We have a lot of fun because I'm going to get people better naturally and show them the real root cause of their problems. So that's what I do. And it is focusing, complicated. I have such brain strain tonight. So if you see me and I pass out or fall asleep, you know why. So for people who want to be patients, you can go to danpursermd.com and sign up, schedule some time. Is there a place on there they do that, or it says book an appointment, or
Dan Purser MD, and then on the top there's a tab that it has like different options. You can order tests, but at the very end it should say schedule. No, it's appointment. You can click that and you can book an appointment online to see you.
Cool. So from a few weeks ago, I've had a lot of questions on breast cancer and testosterone. Totally safe. Can do that. A lot of you have tried problems downstairs, if you know what I mean. Saying that tactfully. Dry eyes, dry mouth, and dry. And you need testosterone cream. That's your only option. There's nothing else that's going to help you. Another question I get asked a lot, and I'm supposed to clarify this, is Idaho Blue Spruce in women will increase your testosterone. I'm the one who did the research on that originally and turned it all over to Gary and Young Living, but it doesn't work with women. Okay, I hate to cause tragedy among the ranks, but I'm the guy who studied all that stuff. I was actually looking through Young Living's oils for one that increased testosterone. It's just not the way it works. I don't think anyone. I'm probably the only person who really understands how it works. Pretty sure no one else does, but it will not do that. It cannot do that. It won't raise your testosterone level. Sorry, neither will Shutran. But wishful thinking might. I'm kidding. PCOS and high test, I always use DCI, D-chiroinositol bichiral balance. Big clue, big hint, save yourself a lot of money, get it. Try one a day. If you're really lucky, even two a day. 2 a day might make you really hypoglycemic. Now listen, I'm gonna tell you about that event with Star Mori again. You need to come to it. Go look for the link on my Facebook page for the Star Mori event. Check it out, buy some tickets, sign up, do whatever. Do it. Also for blood and genetic testing, which a lot of you like, you can go straight to my website, order it yourself, have it done. You can go look at my videos, tells you how to treat it, or set some time up with me. We're still having our fibro bundle cells, is that right? Mm-hmm. All physician design cells are they still ongoing? Do we ever turn those off? Ever?
Well, we have 3 for 100 right now on MTHFR support plus and
cool.
copper balance, and then 2 for 100 on VARs. So, really good deals right now.
2 for 200 on bars?
2 for 100.
We're giving them away?
We're giving them away, basically.
Okay, remember we just got awarded a huge patent. We're actually meeting soon with the FDA in regards to our glutathione. I have a rumor it's going to end up the supplement version with someone you know and love soon. Maybe. I don't know for sure. I'll never confess I know that. Unless it's on a private call or something. You pay me money. Let me see. There's something else I got to talk about real quick before we dig into the questions of why your hubs, your boyfriend, your whoever has your boss at work, I hope not, has low testosterone. So let me check email. Star Mori, Men's Handbook B, you know about that. Improving male sexuality, you're going to get this. Download these now.
I just posted the links for those two.
Okay, I don't know how much longer they'll be on sale. International shipping now through physiciandesign.com for all my fans elsewhere in the world. Through DHL. Asia, Australia, Canada, Jamaica. Will Jamaica work? We have 2 followers in Jamaica.
2.
Okay, and 3 in the outer Maldives. Maldives?
I don't know, but I want to go there.
I have like 7 people. None of you know that.
What are their names?
Merle, Jethro, and Bonita.
Oh, yeah.
I know them like the back of my hand. So I think we've covered all that. So hold that really steady. Because my eyes are really tired from looking at charts and genetic stuff all day. My super fan, Lois Schweigert's putting on a guided relaxation for chronic pain seminar. Is that what it is?
Yeah, like meditation.
It's on what's the name of that place?
It's End Fibromyalgia with Natural Options.
End Fibromyalgia with Natural Options. I go on there occasionally, answer questions, make comments. They're moving a lot of people through there.
It's a really great group for people who just want support with their fibromyalgia, and there's lots of supportive
people. It's really
people.
based on the theory that copper dysfunction, but copper metallothionein dysfunction causes your fibro. So you can go on there and hear success case after success case of new people, patients of mine, who have recently picked up and kind of referred there. Can you give me a card I can give out to new fibro patients?
Yeah.
Has that link on it? Yeah, because I can't remember what that
Yeah,
thing's
no problem.
called. And you helped me go on there a minute ago. That's Wednesday, July 30th at 7 p.m., so a week from tonight, from 7 p.m. to 8 p.m. Mountain Standard Time.
Mm-hmm. The most important thing is, though, you have to join the private group there.
Oh, you join the private group on the End Fibromyalgia with Natural Options Facebook fan page. Mm-hmm. And they're the one they're fanning?
Yeah.
Or they're fans of fibromyalgia. I don't think anyone's
They're
a
not
fan
fans of fibromyalgia, that's for sure.
No one's
Everyone's
a fan
like,
of
no,
fibromyalgia.
no,
Are
no.
they Sadist? No, that'd be horrible. Sorry, I'm laughing. It's a painful, sad laugh. Okay. I cracked myself up. Okay. So,
One of your fans just says, "What do you do in your spare time? I doubt you have much. What do you do?"
this weekend, so my wife has this car, I changed the brakes on it.
That's what he does.
It's actually an older Mercedes. It's not worth taking in to the dealership because they basically one repair bill would be worth more than the car's worth. They charge more than it's worth. So, and I keep it running like a dream. So my son-in-law, he's your husband,
Yeah.
Brad, he and I jacked it up, took the rear tires off, and changed the brake pads on the rear. It's really touchy on that car because it's all computerized, so much stuff on it. Big Mercedes. But we changed the brake pads, greased them up like little pigs, and stuck them back on there. And now that doesn't make the weird whistling noise. Yeah, whistling noise equal brake pad trouble. Who knew? But
It's great for testosterone too.
yeah, it's manly. Yeah, I don't take my shirt off, but I could, I guess, out there and be covered in oil. Anyway, so listen.
It's disturbing.
I mean, like engine oil. Okay, that'd be horrible. But that would be horrible. Okay, so now.
Getting down and dirty with Dr. Purser. Just working on the car.
Okay, thank you.
You're welcome.
We're not going to go there.
One of our goals always is to get Dr. Purser laughing so much that he chokes. We've never done it live, but
It's-
this may be something.
It's a dangerous game we play, but
We're not
it's
going to do
pretty
the
fun.
choking thing. We're not doing it.
We won't do it today. Sorry.
Okay, so yeah, they usually do it while I'm driving. And then it becomes this death-defying weird thing. So, okay.
The adrenaline rush.
Yeah.
It's really fun.
I drive a very safe car, so it's all right if we have a wreck. Okay. So, you have some questions.
I do.
They're excited. They're like, I can hear the jungle drums beating away. They're wanting answers.
Yeah, so if you guys have any other questions, start asking them now. And
Ask
I'll
now. All
filter them
three
in.
of you watching,
Yeah.
ask now.
Yep. Okay, so let's just get right in. So,
Well, it's a state holiday in Utah.
Yeah.
And I think everyone left the state.
pretty much, we're the only
We
ones
have like
left.
3 people on this Facebook Live. Usually we have about 100,000 or 200,000. So, wow, everyone left the state. It's
Yeah.
Pioneer Day when the pioneers first came into Utah, and they had really high testosterone levels. And they swung their axes and hauled their wagons and beat their oxen. They got here. It was rugged. It was hard. But they were men, and real women back then. Okay, let's get off that subject.
Well, let's just dive in. How do you define low testosterone for men?
Low testosterone is below 800 nanograms per deciliter in a man. Total testosterone levels. I don't really put much value in free testosterone levels. If they're at 600 or 700, I consider it differently. But that's mildly low testosterone levels. If they're at below 600, that's moderately severe testosterone deficiency. Below 400 is severe testosterone deficiency. They used to have this up on the American College of Endocrinology website, and it got pulled down. Not sure why. Neither was my friend who was head of the academy. No, he wasn't sure why or who pulled it down, but they wouldn't put it back up. So when they were trying to define that men really didn't need testosterone, but we know the truth. Okay, next question.
What are the symptoms of low testosterone?
Fatigue, depression. It's hard to...
Define
You
it.
need to know, I look at testosterone as a symptom. Low testosterone is a symptom of something deeper always. There's something else going on. It does not magically occur all by itself. So, and that often causes these other problems. So muscle wasting, low libido, ED, things like that are definitely signs of low testosterone.
Yeah. Well, you kind of answered it, but you said, like, what's the range for hormones that you want men to be in? Does it depend on age or...
No.
No, it doesn't depend.
Anything about 18, 17, 18, I'd say 16, 17, 18 or above, 800 or above.
Yeah, and that's good.
And I've seen young Division I football players with levels above 1,400 and we'll get to that later maybe. And I've seen guys in their 80s with levels above 1200. So not on anything. None of them were on anything. It's so obvious when they are looking at labs. When someone's experienced and looks at a lot of labs, you know right away if someone's taking something. So I've seen that gamut. So a 16-year-old superstar high school football player could easily have a 1400 nanogram per deciliter testosterone level.
Crazy. Do you want me to go to the next question?
Yep.
Okay.
Keep going.
What's the most common cause of low testosterone you see in young men?
Vitamin deficiencies, but it's usually genetic as a real root cause. But here in Utah, it's vitamin deficiencies almost always. I see a few high school football stars who have had concussions. Anytime you have a concussion, you have a 100% chance you've damaged your pituitary. And so you got to consider whether the damage is severe or not. It's another matter. It may be mild, but it's been damaged. And someone who's had 4 or 5 concussions, and it can take 3 or 4 or 5 or 6 months for a young guy, even a year or two, because their levels are so high at 1400. It can take them a year or two to drop to below 1,000, to below 800, to below 600. And so then you get someone's attention. But it's still, that's pituitary damage, or they've been in a car accident or something. That's how I killed mine. I was in a car accident.
Yeah. Do you find it's a different cause for men who are middle-aged or elderly aged, or is it generally always pituitary and vitamin?
Always, the vast majority of them are nutritional.
Cool.
Which is shocking for most of you. But you want to know root causes, that's why you come to see me. That's my job to figure it out. But I'd say the vast majority, 98% of my cases are nutritional deficiencies. But then when I dig deeper, it's caused by genetic errors that block the absorption of key vitamins. We've been over and over and over this time and time again. Mm-hmm. And you'll see that in here. That's how I approach it. I get a SpectraCell, and now I do genetic testing and try and figure out what's going on with that kid.
Yeah.
I get a lot of kids here in Utah getting ready to go on LDS missions, and their parents bring them in and like, can you check his testosterone? It was low a few years ago, and we're still worried it's still low. And I'm looking at this blonde-haired, blue-eyed kid sitting across from me, and what does he have? What do you think he has? Any ideas? You got blonde hair, blue eyes. What?
MTHFR.
Yeah, MTHFR. Okay, so, and probably other methylation errors. So,
Yeah.
and then you do a SpectraCell, and a ton of vitamin deficiencies come up, and you got to deal with them. And you can get that kid's testosterone to come up naturally. That's going to be my answer over and over and over again tonight.
Yeah.
So I just gave it all away.
We're going to keep answering that same question.
Yeah,
though.
probably.
It'll be fun. Because it's so simple, but complicated. What do you see is the most common cause of loss of libido in men?
Low testosterone.
Yeah.
They don't need, what's the blue pill? Viagra. I've never, I prescribed it probably twice because someone asked for it, or Cialis maybe 3 times because someone really, really demanded it. Just, if that guy's treated right, we deal with all the real issues, they don't need that. Never found anyone who needed that.
Yeah.
In my heart of hearts.
How would you treat an 18-year-old with low testosterone?
Well, it's according to the cause.
Okay.
If it's pituitary, I'd figure it out. I'd use HCG, human chorionic gonadotropin, and maybe clomiphene citrate. Try and get his levels up.
Yeah, and just do it.
HCG is like an insulin injection. You have to get it compounded. Or you don't have to. You can get the name brand, but it's really expensive. So, and it's not I've had doctors come and say, why did you put this patient on there? This is a illegal drug. Some of them like, what? It's in the PDR. It's FDA approved for exactly why I put them on it. Are you kidding me? And they were really embarrassed. I think at that point they go back and look and like, true. So nowadays with Google, they're not quite as bad, but yeah, I'd probably use HCG.
Would you treat a 45-year-old man differently?
According to the situation, you want to have kids, what do you want to do? Is he in a second marriage? What's going on? Why is his level low? But it almost undoubtedly his would probably be vitamin deficiencies. Maybe pituitary, I'd find out. It's in the history, you gotta look or dig deeper. The number one lab I see when people have low pituitary dysfunction is a low IGF-1. But then again, it could be from vitamin deficiencies. Thus, the SpectraCell, we used it where I did research, we use it here in my office. You gotta make sure they don't have vitamin deficiencies before you put this guy on HCG and clomiphene citrate or testosterone the rest of their life. And I get a lot of young men, 18, 17, 19-year-old with pellets. Are you kidding me?
Yeah.
And we'll use pellets as a very, 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 very last resort on an older man who nothing's going to help. Because maybe his testicles got smashed in a car wreck or something horrible. Or he's had testicular cancer or something like that. But an 18-year-old, no way. It'll sterilize them temporarily, but it'll sterilize them. So don't do that.
Yeah. So like you said,
For a 25-year-old too.
Yeah.
35, no.
Yeah, exactly. But like you said, for an older man, you would maybe consider doing other options like a pellet or rarely. So
Last resort.
so generally you're going to do the same kind of treatment, just depending on if it's a vitamin deficiency or pituitary. Read in the book.
It's in the book. I detail it out. I show example after example. I show SpectraCells. I show all kinds of weird results in there. But I dig into it. That book was number one for a reason. So
Yeah. What's a good testosterone supplement is the word someone used for an older man, or what is a good recommendation you would use?
a good testosterone supplement for an older man.
Yeah.
I always do a stepwise approach to start them on cream or gel first. Not everyone absorbs the same. A lot of men just don't absorb testosterone cream. Me, for example, I could fill a bathtub with it, roll it like a pig in mud all day. Nothing would happen. My levels wouldn't change. I'd be greasy, but I wouldn't have a higher testosterone level. Don't even want to think about that. Okay, so yeah.
How come people don't absorb the creams?
I don't know. Some people, their skins are impervious to creams, oils, whatever.
Yeah.
We've tried everything.
Yeah.
I've tried probably 15 different kinds of testosterone creams and gels.
Yeah.
Doesn't work.
Interesting.
Wish it did. Because I can't make it.
Yeah. Have you found that testosterone lowers as men age, or is that kind of a myth?
It's not a myth. In general population, it will go down, but in specific specific cases, I've seen it not lower. I've seen guys in their 60s with normal testosterone levels above 1100. No, above 1100.
Yeah. That's
Not on anything. I've seen guys in their 70s above 1100. I've seen an 85-year-old with a 1250. Not on anything.
amazing.
And no tumors, no weirdness, just looked 50 years old, healthy as can be. When he gave me his labs, I thought he was his son giving me his dad's labs. Yeah. But if you measure general populations, because a lot of guys become malnourished, that has vitamin deficiencies. A lot of guys have pituitary trauma or testicular trauma or cancer, whatever that beats them up. But if you're beat up, first thing you have to look at is testosterone levels, and then go to, is it a vitamin deficiency? Get a SpectraCell. And serum levels just don't compare.
Yeah.
Serum levels are sad and funky little things compared to intracellular. I don't even bother with them anymore.
Yeah, just directly to the intracellular.
It won't tell you, because genetic errors block your ability to absorb key vitamins. And so, unless you get a SpectraCell and look at intracellular levels, you won't know what's being blocked.
It's crazy.
Weird, huh? Okay,
Weird.
next question.
Okay. How can you tell if it's pituitary damage causing low T?
I'll take a fasting IGF-1 along with it. And then go by history, guess, try. If I give them HCG and clomiphene, their testosterone still doesn't come up. It's a vitamin deficiency, better look. Because the vitamin deficiencies mimic pituitary damage and everything. Maybe get an MRI, but they're usually not very helpful. It's too minute a detail for even one of the newer 3 Tesla machines to show you. They're supposed to come out with a 6 Tesla, We'll see. When that comes out, it might give us the detail we need. But right now, not enough detail.
Yeah. Don't you usually ask your patients, "Oh, have you been kicked in the head or knocked out?"
You ever been
or-
knocked out,
Yeah.
lost of consciousness event? If they tell me 4 or 5, I'm like, ooh, okay.
Not good.
Yeah, and if they see I was out for 5 weeks like I was from a car wreck. Yeah,
Not fun.
yeah, bad.
Is low T related to MTHFR?
Absolutely. See it all the time. Probably the number one genetic cause of, at least here in Utah, of low T, vitamin deficiencies in men and women. I see a lot of ovarian insufficiency or failure in low testosterone young women because of MTHFR and other methylation errors.
Yeah.
My eyes are about to fall out.
Is there a specific vitamin deficiency that you commonly see with low testosterone, or can it affect lots of different ones?
B12 is bad and zinc deficiencies are bad. Zinc deficiency causes a lot of different problems. But zinc, you need it to make testosterone. Glutathione is another one, but that's usually from the low B12. It's kind of a circular thing. Low B12 causes low glutathione, causes low testosterone. Yeah,
Just a
you
cycle.
got to deal with it. Yeah, and 3 to 6 months or 9 months later,
It's gone.
they have normal testosterone levels, maybe for the first time in 50 years for some of them.
Wow. What about vitamin D? We had a specific question about that.
Not so much, but still, especially here in Utah, because like this last year, we had 9. This year, we've had 9 months of snow and wet, cold weather, and then about a month ago, it became hot and sunny overnight.
Yeah, 100 degrees.
Yeah, and maybe that'll last through the end of August, and it'll snow again. So it's kind of weird, but yeah. So take your 5,000 units of D3 and go with it.
Yeah. Someone's wondering how much zinc in B12 daily. Is there a specific amount that you generally see?
It depends.
Or just case by case?
Depends on your genetic issues. Depends on your deficiency. I usually use zinc picolinate, 50 milligrams a day. Yeah. And B12 varies. I always use methyl B12 at the least, if not adenosine hydroxy B12. Those 3 forms.
Yeah.
I just never use cyanocobalamin anymore because of it's made from cyanide, cyanocobalamin, and it's cheap and it usually can't get absorbed.
Yeah. You mentioned earlier that the vitamin deficiency kind of mimics pituitary damage. Is there any way that you can kind of tell which one it is without testing, or generally you have to test?
You got to test.
Yeah.
History can give you a better educated guess. So yeah, from that maybe.
Yeah.
That's why I spend so much time asking weird questions. When people come in, they're like, "Why did he ask me that? What's that mean?" Yeah, I'm trying to figure out. Do you have a damaged pituitary, or is this a genetic thing? What's your heritage? Yeah. Oh, you're Scandinavian. That's MTHFR, Northern Europe, MTHFR. But my wife, your mom's from Spain. She was kind of blondish, bluish. When I met her, she had
Yeah.
blonde hair, blue eyes. And she, yeah, her heritage is definitely Spanish. But she has bad MTHFR.
Yep.
Yeah, and her
Give it to
dad
all
had
of us.
blonde hair, green eyes, yeah.
It's crazy.
And they're royalty, and Spanish royalty of some sort.
Mm-hmm.
Yeah.
Someone's wondering if you can show the book again, or what the name of it is.
It's called Improving Male Sexuality, Male Sexuality, Fertility, and Testosterone. You'd think I'd remember the name. I wrote it a few years ago.
That was a couple
Just
years ago now.
Super tired. Yeah, and it's $1.99 right now on the Amazon Kindle for download, or get the paperback. They love making you these little paperbacks and killing trees. So, men with axes and high testosterone levels are killing those trees.
Okay.
And
Next.
this is another one. I get them both. The Program 120 for Men, it's $1.99 too. They've both been bestsellers on Amazon. This tells you what your level should be and why, what the literature says. Where did I come up with all this nonsense? When your doctor's going, oh yeah, your 420 is fine, or your 280 is fine. It's within the range. Here's the range. Here's what the literature says. Not what your doctor, who's never been in research for any of this or knows much about this, tells you. Okay, next one.
Yeah. So someone said their husband has low testosterone and low sperm count. What is the cause, and what would you say should be the solution?
Could be pituitary, probably not. It's going to be a vitamin deficiency caused by a genetic error. But does anyone do anything about that? No, I don't. They know they're going to cause you $12,000 though to give you IVF, or that's cheap. That's Utah rates. $30,000 if you're in California for IVF. When in reality, it's probably your husband's low sperm, low testosterone / vitamin deficiency / genetic error that's been given to him by his dad, his grandpa, his passed down through hundreds of generations.
Yeah.
You wonder how we survived as a human race.
Really?
Yeah, someone figured out how you survive. Whatever.
I got lucky. So someone else's husband, they received testosterone injections, which they were told would help with his energy and libido, but he's still super tired and still really low libido. Do you know why this would be?
Yeah, vitamin deficiency. They didn't deal with the root cause. Great. Let's give you testosterone. That's slapping duct tape on a
Gushing
razor
balloon.
cut. Yeah. Not going to heal it.
Or I put it.
It's going to hurt when it pull the hair off.
Yeah.
But yeah. They haven't dealt with the root cause.
Are there any essential oils that you recommend for testosterone?
Yeah, I like Idaho Bliss Boost and Shutran for men's. It'll help. But really deal with the root cause first.
Yeah. See what's.
Yeah, I'll tell you the number. So ask me what product. If I had to choose anything, what would I choose for a young married man who has low testosterone, or even a young man with low testosterone? I don't care if they're married or not.
What product?
Yeah, I'd choose a good multivitamin like Master Formula.
Yeah.
Forget everything else.
Yeah.
Super Bees and Master Formula are going to probably be your answer.
Because you start with the basics.
80-90% of them are going to get better. Did you hear that? That's free. Buy Master Formula. I don't get paid a penny for Master Formula. Yes, I had my hand in designing it. We designed it based on spectra cells I had from 1,000 of you. Yeah, it's going to be a vitamin deficiency. Odds are. I know, hard to imagine in 2019 that you have a vitamin deficiency that can lay you low. See it all the time. I deal with it every day.
Yeah, that was my next question. You just answered it. The one vitamin supplement.
Yeah, Master Formula.
That's
If
fine.
you're not Young Living, get Thorne Basic Nutrients 2.0 or 2 a day, I think they're called.
Yeah.
Yeah, that'd be your other option if you're not Young Living.
Next question. This one, their husband has low thyroid and low testosterone. He's tired all the time. Which one would you look at first, or what would you look at first, and why?
Both of them. I look at SpectraCell because it could be a twofer. You could have a zinc deficiency, which would cause both low thyroid and low testosterone. You treat them, and both problems go away.
Man.
If you can't find a nutritional cause, and it's like Graves' disease or he has thyroid antibodies or something, I treat his thyroid because when his thyroid comes up, it'll pull his testosterone up with it. Thyroid kind of is a more master hormone. Testosterone's not. Oh yeah, the number 2 supplement from Young Living or from anyone I would use is PD8020, i.e. DHEA and pregnenolone. I like PD8020 for men. 2, maybe 3 a week. Don't overdo it. They'll break out.
Yeah.
They don't readily convert it to testosterone, but it definitely helps.
Someone's wondering, why are we so vitamin deficient as like society nowadays?
Well, I think any Young Living distributor, a lot of my followers know, our food is really sucky. So we eat a bunch of crap all the time, maybe.
Well, with all our genetics too, it's just getting passed down more
It's getting
and more
worse.
and more.
It's stacking. I gotta believe.
Yeah.
That's why everyone has symptoms from it back. But you think 50, 60, 100 years ago, people were just trying to survive. They didn't care if they felt bad. They just wanted to eat
Yeah.
that day and make $1
True.
or a quarter or whatever. So now we have too much leisure time. We can go, I really feel horrible and tired and I can't get an erection. Oh, sorry. I didn't mean to say that out loud.
That's fine.
And so they go figure it out.
Yeah. Well, now we have time to figure it out.
Yeah, and probably unrealistic expectations caused by porn movies and stuff. You guys think they should be able to go 24/7, hardcore all day long? It's just like, no. 2 or 3 times a week's awesome. For an 85-year-old. Shut up now.
The next question is, this man has adrenal fatigue and low testosterone, and he's wondering if he should take cortisol.
No. Okay, let's talk about adrenal fatigue. I know all of you love adrenal fatigue. You hear it all the time. It's not really a diagnosis. Did I say that out loud?
You said it.
It's
You
not-
said it.
We never studied it in the 10 years I did research and stuff. It's not really in a medical book. There's no such thing. It means your adrenals aren't working properly. It doesn't mean that they're burnt out. Why would adrenals not work properly? Guess?
MTHFR, vitamin
That's
deficiencies.
exactly, you nailed it right on the head. Wow, you got it in 2.
Gold star?
1. Yeah, you got it. Yeah. Yeah, because their testicles aren't working properly, their adrenals aren't working properly, their thyroid's probably not working properly. We call that the dwindles. Women and men both get it, and except for their ovaries aren't working, not their testicles. It's because they're malnourished, because of vitamin deficiencies, and genetic errors blocking their ability to absorb vitamins. Thus, I am always suggesting genetic testing. Just go with the flow, get it, follow me. I'll lead you to the holy place. That sounds odd. Okay, never mind.
The holy place to health.
Right.
Sorry. So, this is a question from someone saying that their doctor told their husband that he was low in testosterone, but their insurance said no to any cream because it wasn't low enough. I know you've answered this, but what other options does he have? Or what should he really be looking at?
1, get another insurance. 2, why are you using your insurance anyway for this? They're going to jerk you around. That's why I quit dealing with it a long time ago. My friend down at the university, who was a U.S. Assistant Surgeon General, he never dealt with insurance. He just, come on, they're not going to help you with this. It's not expensive to figure this out. Really, let's say you had to do every test I suggested, go to my way. You might be looking at really, maybe at most at the upper end, maybe 12, 13, 1400 in all labs, but then you know for sure exactly what the cause is. Plus paying my time, you might be out $2,000, but you know, and it wouldn't be guessing the rest of your life. That's the most it would be. Probably be more like half that or less.
Yeah.
So, and you want to get cheap with it, not get the testosterone cream. You need to get away from that mentality. Hey, guess what? They won't approve Progestin Plus either. They won't approve Shutran or Idaho Blue Spruce. They won't approve a lot of essential oils that are awesome. Lavender, which is incredible, or clary sage, which is more incredible. They won't approve it. Does that mean you're never going to use it?
Hopefully
Yeah,
not.
right. You're going to be pouring that oil all over yourself and dancing under the moonlight. I know what you do. So, okay.
What about low testosterone and depression?
Yeah, because of the vitamin deficiencies, it's going to cause you fatigue and depression. Which came first, the chicken or the egg? I'll argue that I can treat your testosterone. You'd probably still be depressed, still fatigued, and still have ED because you're so tired you can't get an erection because you haven't dealt with the root causes properly. Check a SpectraCell. Check a genetic panel. Find out what's going on.
I know this is a big question always, is does taking testosterone cause a heart attack or a stroke or anything like that?
There were 2 studies that came out a few years ago. I think they were written by like 3rd graders. The math on them was done by someone with that level of education. They were really weird when they came out. It took about a week for every doctor on the planet who knew anything to destroy those 2 studies. Yet the government, the VA, all this stuff said, we're not giving testosterone because it'll cause heart attack. Really? Those are weird, bad, really odd studies that came out that should never have been published. Really, one got put on PLOS One, When you can't get your study anywhere else, you go to PLOS One. They'll publish anything, I think. But wow, so those have been discredited completely. No, you get a big reduction in heart attack, stroke risk when you keep your testosterone levels up.
Gotcha.
Assuming you're using bioidentical natural testosterone options. You get the weird stuff, can it cause inflammation? I know guys come in wanting all this exotic, weird muscle building testosterone. No. Not going to have much patience either.
Yeah, I'm not good. Do you check estradiol levels for men when you're checking like their testosterone?
I used to do it. I never was a fan of it, but now the theory is, look, I get young BYU football players who are levels of 1,400, or University of Utah guys levels of 1,400 total testosterone, not on anything. They have super high estradiol levels. If they're playing in the NFL, I have a lot of ex-NFL guys, and they have high estradiol levels. We don't treat that. No one treats that, nor does the NCAA treat that. No one treats in university football teams or basketball teams high estradiol levels. Don't do it. It's not because it's not allowed by the NCAA. It's just dumb. There's no science behind that. And I heard the best lecture by Neil Rouzier at the Tucson conference I spoke at AMG in November of last year when I spoke there about pituitary dysfunction, growth hormone, and all that kind of stuff. He permanently changed my mind. I don't deal with estradiol levels. I won't do it. It's worthless, pointless. It does not cause boobs. Gynecomastia. No. Marijuana will, but okay.
Interesting. Do you ever give HCG to increase testosterone levels?
All the time. Pituitary damage, guys, all the time.
Can you tell us the symptoms of low testosterone again? And, like, can it affect ED or?
Yeah, ED, depression, fatigue, low sperm count, low libido, muscle wasting, painful muscles when you're trying to work out, you tear your muscles, stuff like that. Don't work out if your testosterone's low. You're just going to get hurt.
Do you ever give...
Sorry I'm squinting. My eyes are just so tired.
You're good. I just got a couple more questions. Do you ever give HCG to increase testosterone levels?
Yeah, I just answered that.
Oh, sorry. I meant clomiphene.
Clomiphene citrate?
Yeah.
Clomid. Yeah, I use it all the time.
There's just lots of...
Again, in young guys or middle-aged guys who want to have kids, and we've done everything else first. Remember, we do this stepwise. Get the book, Improving Male Sexuality, Fertility, and Testosterone Levels. I cover everything in here. But get the book, Clomiphene, Last Resort. No side effects, really. Just because I had one person had a really weird reaction to it, but I've never seen that before. I use it both men and women. And I use HCG in both men and women. HCG, so let me explain HCG. After this, you're all going to know a lot more than any doctor I've ever heard talk about HCG. I'm the guy who lectures about HCG. HCG is a really big molecule. Women make it in their placentas when they're pregnant, but both men and women make it in the stalks of their pituitary. It's a really huge molecule, mainly because it's a bunch of LH, luteinizing hormone, 80% LH, that HCG molecule, stuck together LH and 20% FSH, and maybe 1% TSH. It's really designed to further advance the sexual development of the unborn child. So it's perfect for guys or gals to take to increase their testosterone levels when they don't have any vitamin deficiencies and maybe they have pituitary damage. That's when I'd use it.
Gotcha.
Clomiphene citrate, too.
Does high testosterone affect blood sugars or your A1C?
Normal testosterone levels, meaning above 800 to 1200 roughly, or if you're a young guy, 1400, dramatically improves insulin sensitivity. Insulin receptor functionality gets a lot better. I kind of think of it as oil for your insulin receptors.
So if you have low testosterone, it's going to affect that.
Oh yeah, definitely. It sets you up for insulin receptor failure, diabetes.
Gotcha.
You better find out the cause and treat it appropriately. So will having a zinc deficiency. So will having a B12 deficiency both cause insulin receptor dysfunction.
Yeah. Someone asked, how will these methods work on a 15-year-old boy with a gynecomastic body?
Gynecomastia. Some breast tissue. I need to look at his genetics. I need to look at his SpectraCell and make a careful judgment of him. Probably more than one set of genetics. When I'm really stumped or really want to dig deep, I'll tell him to get a 23andMe, change your name, change your date of birth slightly, and get the 23andMe. And then you link it to a NutriHacker Complete and Prometheus. I want to see both those, PDFs on both those. And then I'd use our GX, Dan Purser MD developmental Pro 7 panel. Pro 7 developmental panel, whatever it's called. Help design it.
Yeah, Pro 7.
And get all three of those, and you'll have a really good idea what's going on.
So someone said that their husband had a blood test for testosterone, and it came back at 727. Supposedly the rest of the blood was normal, like levels. Would this cause ED? Or is that pretty...
According to where it was before, what did you have a previous level? They don't know.
They didn't say.
It's 727. It's not normal, but it's really close to normal. So I'd probably wonder he's missing some vitamin. I'd probably ask more about symptoms. Is he fatigued? Is he tired a lot? Is he stressed? That'll cause ED. Is he 63 and has cholesterol buildup? That'll cause ED. So I just don't know enough to pass judgment. Oh, man. Sorry, fans. I'm just really tired.
We can start wrapping up. This is kind of a random question. So the problem was...
I've never gone less than an hour. Will they riot?
It's okay.
I have this fear. I had that big flagpole out front. One morning, a bunch of women rushed into my office, dragged me out, and hanged me at the flagpole because I screwed up a Facebook Live. Don't do that to me. Okay.
So someone had an opioid-induced malabsorption disorder in their gut from taking opioids from trauma, and they are wondering if they should, for their low testosterone, look into vitamins or a different approach. I don't know if that...
I need to know the trauma, why they were having trauma, why they're taking opioids. Let me be really clear about this. They're wrong. Whoever gave them that diagnosis is wrong. Opioids will not lower testosterone level. But men who have low testosterone can have a lot of pain issues, and they'll get put on opioids. My friend who runs Nexus, the big pain clinics.
Rosenthal?
Yeah, Richard Rosenthal is president of the American Pain Association Society, I think it's called. He and I got into this and looked at a bunch of different patients, and I kept saying, my conclusions were, after careful histories and looking at these guys, that they had low testosterone and pain before they started the opioids. And no one's ever done anything to deal with it. When you get their testosterone issues fixed, a lot of their pain goes away, and they can go off the opioids. He loved that. So now he deals with it. We both deal with it a lot, but it's just the way it is. It's not. Everyone thinks that. Even a lot of doctors think that. Most doctors think that. 99% of doctors think that, but they're wrong. Sorry, they're just wrong. It's which came first, the chicken or the egg. I'll tell you, the low testosterone came first. So it has nothing to do with that guy's opioid addiction or not.
Yeah. That's good.
His vitamin deficiencies, yes.
Definitely.
He probably has some crazy, funky genetic errors. The same way I drill into all of it. Boom. Get a SpectraCell, get the GX kit. I don't talk about it in here, but trust me, that's what I do now. Find out what's going on.
Yeah.
And they'll have the answer for that young man. So that's a great question, but a surprising answer for me probably.
It's good.
Yeah.
So this man, he had a low testosterone. He was given testosterone cypionate, and then he was taken off of it just because he had to switch doctors. But he noticed that he started to fly off the handle, and he was wondering if this is related to excess copper.
Huh?
I don't know. It was just an interesting question.
I know a lot about excess copper, but not in that situation.
Yeah.
No. So several things I don't know. So when you take testosterone cypionate, which I do use occasionally with some patients, you need to give it at least weekly, if not even twice a week. And you need to monitor the levels. If you're 18 or 1900 or 1700 or 1400 and you're of the age that's just really high for you, yeah, you might have anger issues and fly off a lot. So I don't know, did he have those kind of levels? How often was he taking? How much was he taking? When did he give the shots? Who gave him the shots?
Yeah.
There's a lot of questions. I just don't know.
Yeah.
But if you keep someone like that and bring them down maybe to 800 or 900, they get real happy. You need to be in that sweet spot, 800, I'm tongue-tied now, I'm tired. 800 to 1200. You know, I'd keep right around 900 to 1,000.
Yeah.
That's a really sweet spot for guys.
Yeah.
So he should probably make an appointment with you sometime, and you can talk to you.
Yeah, all these people should all call me right away tonight and try and get an appointment. Or go on danpursermd.com and go to wherever.
Order the testing because it'll really help you.
They can order the test and get it now. It'd be a lot easier. We can figure it out in 1 or 2 visits, but
yeah. Because that's the other question. Someone was wondering. So they get a SpectraCell. They start taking the vitamins. Do they need to test their SpectraCell again after a few months, or will
if
it
it's
just
really
be
bad, if they have 12 to 18 deficiencies and borderline deficiencies, which I see, or if they have a really bad B12 deficiency or something crazy, yeah, I'll say let's retest it. Usually 6 months.
Yeah.
4 to 6 months, not just in a month or 2. It takes 100 days to change intracellular levels. 100 days.
Yeah.
So
But generally-
100 days of master formula.
But generally, you'd say most people, once they start addressing the issue, they just start feeling good and they're good to go, right?
They notice it pretty quick.
Yeah.
It does take a while to get the machinery working again.
Yeah.
The vitamins need to get through, get into your cells,
Yeah.
start the machinery rolling, get the machinery pumping
Warmed up.
out little things like testosterone and sperm, stuff like that. And then 3 to 6 months, you start to feel good. You'll feel good right away if it's the right vitamins.
Yeah.
It's magical almost, but you really start to feel normal, hard, solid. I didn't mean to say hard, but solid, good, just really solid after 3 to 6 months.
Yeah.
So if you're suffering, if you're going through all this crap, and your doctor's like, you have low testosterone, I give your doctor 2 points for diagnosing your low testosterone. But if he goes, let's give you testipionate, and they don't really dig deep or anything, or let's put some pellets in, I'd probably want to know the cause. Ask why. I've told all my patients this, I tell you guys this, always ask why. If that doctor can't answer it, find someone who can. Find someone who can tell you why. That's what you want to know. Why is my testosterone low? Why do I need this? Why am I so tired, but you're giving me testosterone? Why is my thyroid low too? Why are all my hormones low? What's going on with me? Am I dying? Yeah, you can die from vitamin deficiencies.
You saw a scurvy case not too
I've
long
seen
ago.
4 scurvy cases in the last several years. Yeah, and they're dying.
It's crazy.
So yeah, and trust me, they've been to 15 different doctors, and no one can figure it out. But don't let that be you.
Yeah.
So yeah, I've actually seen a 3 and a 4. That's my 3's the lowest on a testosterone level, total
Level
testosterone
3.
for a man.
Holy moly.
Yeah, wow. And a 4.
Crazy.
Lowest. I never thought I'd see someone that low. That just broke my heart.
What were their age?
I can say.
Okay, sorry.
Bad.
That's crazy.
They both had a lot of trauma in their
Yeah.
lives.
That's rough. Should we wrap up?
Yeah, I love all of you. Thanks for listening. Grab my books while you can. Post questions if you want. I'll try and get to them over the next 2 or 3 days. Go to danpursermd.com. and set up some time if you want your husband taken care of. Get a SpectraCell micronutrient panel. You can have the 2 tubes drawn locally. I'll send a script with it if need be. So saying, please draw this sad little person's levels, the tubes, 2 tubes. And then you tilt them 10 times. Take them to the right FedEx in your area, not the cheesy FedEx, but the hub FedEx or the FedEx that can ship it overnight to Houston. So we've got to figure that out in advance or you'll screw up that day and be driving all over the place. Know exactly where it is. Get it there before 5 or 4, whatever their last shipment out time is, and then sit back and wait for the results. Call me, give me the results. And let's meet.
Awesome.
So let's talk over the phone. I can prescribe vitamins over the phone. I cannot prescribe testosterone over the phone. Got to follow the laws. This is Dr. Dan Purser. God bless and go in good health. I love you all.